Hi, this is Dr. Parijat Kumar. I am the current founder director of International Sports and Orthopedic Manual Therapy. Thank you guys for giving an overwhelming response to this elbow, wrist and hand lab. We had like more than 2,000 registrations. And welcome to the quiz answers. I understand that today's quiz was a bit difficult, but we want you to learn and see what all is available. All right. So let's get started with the quiz questions and their answers. The first question was the tendon that forms the radial border of the snuff box. Yes, that's the snuff box. So we wanted to know the muscles that forms the radial border of the snuff box. The correct answer is abductor pollicis longus and extensor pollicis brevis. Yes, those are the tendons which forms the radial border of anatomical snuff box. All right. The second question was, what is the clinical prediction rule for the diagnosis of carpal tunnel syndrome, which includes everything except, so all the options included in the CPR, but the correct answer was age less than 45 years. That is not a clinical prediction rule for carpal tunnel syndrome. The next question was, the moving valgus stress test is positive if the patient experiences pain between what angle? There were confusing options. The correct answer was 120 degree and 70 degree of elbow flexion. That is the angle to which the moving valgus stress will be positive. All right. The next question was, what is the positional fault of triquetrum in extension radiation deviation syndrome? Yes, it's a syndrome where the triquetrum bone gets deviated, and the correct answer is volar. So the bone comes in a volar direction, this direction. So this is the positional fault of volar in extension radiation deviation syndrome. Next question was, which of the following muscle is not dominant in extension radial deviation syndrome? Sorry, I'll repeat that. Which of the following muscle is not dominant in extension radial deviation syndrome? The correct answer is extensor carpi ulnaris. The extensor carpi ulnaris is not dominant. So the other options are dominant. Next question, what position is not painful in the functional load test? Correct answer is the radial deviation. It's the radial deviation that's not painful in the functional load test. Next question, what is the underlying cause of intersection syndrome? Yes, that's the wrist question, and the correct answer is extension radial deviation syndrome of the wrist. Please guys understand that, study that, and that is very common in the wrist problem. According to Kaufman, how much extension is contributed by scaphoid mobility at wrist? So we were just asking about the percentage, and the correct answer is 92%. Yes, 92% of the extension is contributed by scaphoid in the mobility at the wrist, the extension. All right. What is the position of elbow in radial head manipulation? Yes, when we manipulate the radial head, the position is pronation and extension. Pronation and extension is the position of radial head in the manipulation. What is the direction of force in ulno triquetral manipulation? The correct answer is dorsal. The reason why we are asking and teaching you manipulation is because we have seen in our practice that this fixes the problem in like 2 minutes, and the lever and the muscle hypertonicity is relaxed, and that irritation and that inflammation is relaxed. So that's why these manipulation, if you know how to palpate, if you know where your anatomy is, and you perform these manipulations, the problem is fixed in like few minutes or in few days or in few sessions. All right. The next question was actually a bonus question from our last virtual lab on ankle and foot, and I'm sure most of you might or might not have practiced. So the last bonus question was that which direction do we manipulate intermediate cuneiform? Yes, in the foot or the ankle, we have the cuneiform manipulation. So we specifically asked for the direction of intermediate cuneiform. If you know, there are three cuneiforms: middle, medial, and intermediate. So we specifically asked for intermediate, and that to its force. So the correct answer to this was the contralateral hip. All right. So contralateral hip, we do the direction of the manipulation of the intermediate cuneiform. That was like a bonus question. So I hope you learned quite a bit from the elbow, wrist, and hand. If you missed our last webinar or lab, you can see us on YouTube channel, and you can follow us on the iSOMT Facebook and Instagram. We will be uploading our labs on our website. So please stay tuned, and I hope you learn good and practice evidence-based and ethical practice. This is Dr. Parijat, the current founder director of International Sports and Orthopedic Manual Therapy. Keep learning. Thank you.